Hello, everyone. I'm Dr. Gertie Loretta Hurley, the founder and CEO of Taking Effective Action, acronym TEA. Welcome to TEA Sister Voices HIV Chat Series, a roundtable discussion on HIV/AIDS prevention and treatment. Sister Voices is an initiative of TEA, and it is a place where women can find peer support, health education, encouragement, and hope. Our host is Robin Hamilton, an Emmy Award-winning journalist, filmmaker, and writer. Now I'm going to step out of the picture, have a cup of tea, and turn this over to Robin. Here's Robin.
Hello and welcome to Sister Voices HIV Chat Roundtable, where we talk about health to uplift and educate our community to improve our health. I'm Robin Hamilton, your guest host for the day, and we'll be talking about HIV/AIDS prevention and PrEP. We have two highly qualified professionals to help us learn more about HIV/AIDS prevention. First, let me introduce Dr. Patricia Davidson. Dr. Davidson is an internal medicine specialist and member of the medical staff at MedStar Washington Hospital Center. She graduated from the University of Louisville School of Medicine and has over 42 years of experience in the medical field. Also joining us is Ms. Angela White. Ms. White is a licensed independent clinical social worker. She received her master's of social work degree from the University of Maryland, and she has over 10 years of experience working with individuals, including HIV/AIDS patients. Dr. Davidson and Ms. White, thank you both for joining us. So let's jump right into it. Let's start with some basic facts as a refresher. HIV stands for human immunodeficiency virus and is the virus that causes AIDS. AIDS stands for acquired immunodeficiency syndrome. People become infected with HIV through contact with blood, semen, bodily fluids, or breast milk from a woman who has HIV. The virus weakens a person's immune system, which allows other infections and cancers to occur more frequently and severely. Dr. Davidson, I'd like to start with you. HIV/AIDS education has been going on for decades and treatment has improved dramatically. So why is it important for us to keep talking about it in our community?
Because HIV/AIDS affects the African community disproportionately from the rest of the communities. And we represent 42% of the newly diagnosed cases of HIV and only 13% of the US population. So we have to continue to stress prevention, and if we are diseased, we need to get treatment. And there's been so many new improvements in both treatment and prevention that the community needs to be made aware.
Okay. Well, that is good news that there are options in terms of prevention, so that's encouraging. But you're absolutely right. Staying informed is really important, especially as women are still being infected through heterosexual contact at such a high rate. We've been told for years to use condoms, limit sexual partners, and not share needles if you have a drug problem. Get help to stop if you do in fact have a drug problem. Ms. White, can you share a little bit about PrEP? We know that is a prevention medication that some folks may not even be aware of. So can you talk to us about that? And also, can you tell us how living with HIV or AIDS can affect a person's mental health? I know that you have worked with individuals as a clinical social worker.
PrEP stands for pre-exposure prophylaxis. If you don't have HIV but are at high risk for infection, PrEP is an HIV medication that is taken daily to prevent you from getting the virus if exposed. Black women play an important role in the health of not only their families, but also the community. So it's important that they know who PrEP might help in addition to themselves. At this time, the target population for those taking PrEP would be men who have sex with men, those who use substances intravenously, as well as sex workers. We have touched on the physical aspects of HIV and prevention, but there's also significant mental health. There's also a significant mental health impact that does occur, whether it's on the prevention side or after a positive diagnosis. Having compromised mental health can lead to risky behaviors which in turn lead for a high risk of exposure. These behaviors include, like I said, intravenous drug use, as well as sexual intercourse with multiple partners where it's unprotected. Having appropriate mental health treatment can decrease some of these behaviors, which in turn decreases the risk of exposure. On the positive diagnosis of HIV, should that occur, there's room for support groups with peers, psychiatrists, as well as therapy to process what this diagnosis really means for yourself, for your future. How do you explain this diagnosis to your family? How do you deal with the symptoms and the feelings of guilt and shame, as well as how do we talk to our romantic partners about having a positive diagnosis?
And thank you, Ms. White, for mentioning all of that, because it's such a devastating, can be such a devastating diagnosis. And I think people need to know that there are options, there are ways to handle it and navigate this new way of life. So thank you for mentioning all of that. We really appreciate it. And of course, prevention is key. And I think a lot of people need to remember that as well, and that there is ways to support each other in terms of good physical and mental health, and of course, education. And that brings me to my next point with you, Dr. Davidson. You have presented at Taking Effective Action's annual celebration of Life, Health, and Wellness Day in the past. You've appeared on radio and television and other venues. And we know that you have been really essential in terms of educating our community on good health. But can you also speak to the importance of getting accurate information to people out there?
That what used to be the highest population of new cases were middle-aged heterosexual women. So that we need to have those very significant conversations with our partners who have not been monogamous as a result of that being the highest population in the past. So that is one of our key issues that we have to remember whenever we talk about HIV.
Okay, thank you. And Ms. White, would you like to add a comment before we close out?
Sure. Accurate information is very important and plays a critical role in allowing people to be active in their own health. Being informed is prevention, which is key in our community.
Okay. Well, many thanks to both of you. This is so important. This is really key information to know. And I just want to go over some of the points that both of you touched on. New HIV infections are higher in the African American community. Also, practice prevention, use condoms, limit sexual partners, and don't share needles. And particularly, if you have a drug problem, make sure you reach out to someone to get help to stop. And if you have family or friends in high-risk categories, encourage them to look into PrEP. Talk to them about taking it after talking to their doctor to see if it is right for them. And finally, learn more from reliable sources. Thank you again to today's panelists. We really appreciate it for all this great information. Ms. White, Dr. Davidson, we really, really are so grateful for your information and your skills. And you can also go to sistervoices.org. And finally, play an active role in your health. You are your own best health advocate.
We hope you enjoyed today's chat. Be sure to learn more from reliable health information sources and go to sistervoices.org. That's SISTAH voices.org. Then go to the Resources tab in the upper right corner and click on the National Institutes of Health HIV/AIDS Resources link. Get reliable HIV/AIDS information you can trust at hivinfo.nih.gov from the National Institutes of Health. Read, print, or download fact sheets on prevention, treatment, and other topics, like next steps for diagnosis, HIV and diabetes, protecting babies from HIV, HIV in couples, pre-exposure prophylaxis, also known as PrEP, and more. You can also access other health information at sistervoices.org under the HIV/AIDS Resources tab. Click the clinicaltrials.gov link to learn more about studies related to HIV and AIDS or other health topics. You may browse the results or enter other search terms for clinical trials information. Click the Medlineplus.gov link from the National Library of Medicine to learn about many health topics, including HIV and AIDS. At medlineplus.gov, you can get fact sheets to learn about diseases, prescriptions, and over-the-counter supplements in medicine. Also learn about genetics and medical tests, and watch surgery videos to understand procedures. Thank you for tuning in to Sister Voices HIV/AIDS Roundtable Chat, where we can talk, share, and learn about topics important to women and our families. Remember to visit sistervoices.org to be sure you're getting accurate health information from sources like the National Institutes of Health. Thank you.